Okay, hi friends, welcome to the Unacademy platform. In today's YouTube live session, again we'll continue the theory part of the upper limb. So we have read the clavicle, the entire humerus, shoulder joint, the elbow, the forearm fractures, the fractures of the Colles and the Smith. So we'll continue with the Barton fracture, then the wrist injuries, and then the hand injuries, and then we'll read a very important topic, that is the nerve injuries of the upper limb. Very important topic. At least one or two questions आएंगे ही आएंगे in any competitive examination. And also then we'll do some question practice for the upper limb. Okay, so currently I'm working as an orthopedic house surgeon in SMS Hospital Jaipur, and I've cracked the NEET PG examination last year only, that is in 2020. And before starting the session, I will just briefly guide you about our various subscription plans that are available for the NEET PG on Unacademy. The first one is your Plus subscription. The Plus subscribers will get access to all our live as well as recorded classes. They can access our entire QBank, and they can compete in live tests and quizzes. Sorry, all of which is found by the topmost faculty for the NEET PG in India. And also we'll allow the subscribers to log into multiple devices with the same account, so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we will be shortly providing them with a printed notes. So while subscribing, you can use my code, that is Anshul B10, to get extra 10% off. The second one and the best one is your iconic subscription. And in iconic subscription, you will get, apart from the things that I've told you earlier, that all the things of the Plus subscription you will get, and in extra me you will get the prep ladder and all the things of the prep ladder, the entire prep ladder including its entire QBank, the video lectures, rapid revision courses, grand test, etc. And on an academy extra me you will get live batch wise classes which are well structured batches. And we have formulated a course in such a way so as to build your basic concepts about any topic or subject first. And also you will be given an individual test assessment sheet after every test that you give, so that you can analyze yourself and work accordingly. So for while subscribing for the iconic subscription, you can use my code, that is Anshul B10, to get extra 10% off. Special classes are very special. I always emphasize on the special classes, and you should attend the special classes because they'll give you extra edge over your competitors. And also in COVID times, you will get live classroom like feeling, where you can interact with your educators, you can participate in polls, and you can watch it anywhere anytime. What you have to do, you have to just download the mobile application and log in into the app using my code, that is Anshul B10, and both of which are absolutely free. And also after every special class that you will attend, you will get the digital notes of that special class. You should solve a QBank because it contains every type of question that is necessary, or that you should practice. It contains the previous year's recall questions. It will cover your entire theory. It is the best way to revise every type of questions, the image based, the X-ray, CT, MRI based, the pathological slides, the recent advances, and very important, the clinical based scenarios or the clinical cases based questions are included in a QBank. So please do solve a QBank. And also we have launched a new feature which is called as raise a hand feature, where you can just tap on a button and digitally raise a hand, so that the educator or a teacher will come to know about your doubt, and you can solve your doubts and discuss your doubts and query there and there on the live platform only. So this will increase the communication between the learners and the educators, and it will make this digital platform more interactive. Okay, and also we are organizing a special NEET PG combat tomorrow, that is on 28th of November, 5 p.m. in the evening. This is a 45 questions 60-minute live test at 5 p.m. and based on the rank and your score, you can win exciting prizes, Amazon gift vouchers and scholarships worth 1 crore plus. So please do participate in this combat scholarship test, and for this you just need to enroll, and you can enroll for this test or NEET PG Combat on a mobile application or a website. And while enrolling, you can use my code, that is Anshul B10, and remember, it is absolutely free. This NEET PG Combat Scholarship test is absolutely free. It is a live test at 5 p.m. in the evening tomorrow, and you can win in exciting scholarships and prizes. Okay, with Amazon gift vouchers and the coupons. And also just 1 day is left, so quickly go and subscribe, go and enroll for this NEET PG Combat. And also this is our various subscription plans of the plus as well as the iconic subscriptions, and here you can see that the cost per month decreases significantly if you increase the duration of your course. So economically also it is beneficial, and academically also you don't want to hop around and study different topics or subjects from different platforms or sources, because it will make your revision, concept building, etc. very difficult. So please do subscribe for subscription plan with longer duration, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. Okay, so let's start today's continue this session, and we will start from the Barton's fracture. Colles and Smith fracture we have already discussed. Okay, we will discuss now the Barton's fracture. So Barton fracture is also a fracture of distal end of the radius, but firstly it is intra-articular fracture, and there will be associated injury to the carpal bone. So intra-articular fracture hoga, and also carpal bones ki bhi there will be injury. So if the displacement is in the anterior side or the ventral side, which is also called as the volar side, it is called as the volar Barton fracture. Okay, and a treatment is like that, for similar to the Colles and the Smiths. First we'll try the close manipulation and cast, and if the reduction is acceptable and good, you can go for the conservative. Agar nahi hai, then you have to go for the surgery. Okay, so this is your Barton fracture. Here you can see intra-articular fracture. Colles fracture, extra-articular dorsal tilt. Smith fracture, extra-articular ventral tilt. Barton's fracture, intra-articular. Now there is one fracture of the isolated radial styloid process, and obviously this will be intra-articular fracture of the radial styloid process, which is called as the Scephoid fracture or the backfire fracture or the Hutchinson fracture. Okay, it is very important name and identification: Scephoid fracture, backfire fracture or the Hutchinson fracture. Now next is true about tennis elbow is. Okay, I'll give you 15 seconds. You can write your answer in the comment box, live chat box. So, which in चार options में से which is true about the tennis elbow? And remember, it is a multiple correct type of question. Yani there will be more than one correct answer out of these four options. Okay, so seen on lateral epicondyle, yes. Medial epicondyle, no. Tendinitis of the extensor carpi radialis brevis, yes. Extensor lateral condyle pe there is origin of the कॉमन एक्सटेंसर टेंडन्स ऑफ द फोरआर्म. सो यस, एक्सटेंसर उनमें से भी मोस्ट कॉमन अफेक्टेड इज योर एक्सटेंसर कार्पाई रेडियलिस ब्रेविस. अब दी यहाँ पे ओरिजिन एंड इंसर्शन दोनों लिखा है. सो एज आई हैव डिस्कस्ड कि इट इज द ओरिजिन, so C is also correct. So A and C both are correct. Okay, A and C both are correct. Okay, now tennis elbow, it is the lateral epicondylitis, whereas the golfer's elbow, it is the medial epicondylitis. So दोनों में similar pathology है, that is there is some microfiber tears at the common origin. Tennis elbow में extensor tendons का, golfer's elbow में flexor tendons का. So there will be pain and difficulty in movement, extension tennis elbow में and flexion in golfer's elbow. Okay, so treatment में the analgesic, physiotherapy, immobilization, and इसके लिए you have a special tennis elbow brace. This is called as your tennis elbow brace, which is worn like this. And this यहाँ पे क्या होता है, it will give support and it will immobilize the small fibers of the extensor tendons which are torn off or which are injured. Okay, also it will compress the extensor tendon muscles over the lateral epicondyle. Okay, so this is your tennis elbow, and medial side में there will be your golfer's elbow. Now special test, we are discussing the test for the carpal tunnel syndrome. Now what is carpal tunnel syndrome? What happens is that there is this flexor retinaculum. So flexor retinaculum के just beneath there is median nerve. So sometimes there is compression of the median nerve beneath this flexor retinaculum, and इससे there will be carpal tunnel syndrome. तो इसके symptoms क्या होंगे? tingling, numbness, pain at the supply of the median nerve, that is the first, second and the third fingers. Okay, the thumb, index and the middle fingers. Now इसके लिए you have some important test. First is your phalanx test, like this. Now there will be pain, numbness, tingling in these three fingers. Tringle test, where if you tap on the transverse carpal ligament, which is nothing but the flexor retinaculum, there will be the same symptoms. And reverse, this is your phalanx, this is your reverse phalanx test, and one is your tourniquet test, which is also called as the Gilead test. टॉर्निकेट टेस्ट और द गिलियड टेस्ट की सिस्टोलिक प्रेशर में यहाँ पे टॉर्निकेट को इफ यू होल्ड ऑन फॉर 1 to 2 minutes देयर विल बी द सेम सिम्टम्स. दिस इज योर गिलियड्स टेस्ट. एंड एक टेस्ट होता है विच इज योर फिंकलस्टीन टेस्ट, विच इज फॉर द डी कुर्विन टीनोसाइनोवाइटिस. ओके, सो इट इन्वॉल्व्स द थंब, एंड थंब में भी कौन सा, द extensor pollicis brevis the tendon. So what happens if you'll hold the hand like this, and if you'll do the ulnar deviation, that is towards the medial side, there will be pain with thumb flex like this. So there will be pain in the first carpometacarpal joint and the thumb. This is your decurvin tenosynovitis. Now we'll study about the wrist bones. तो wrist bone को याद रखना sometimes it's difficult, so we'll have a mnemonic for this. So the mnemonic is: some lovers try position that they can't handle. Okay, and this is first proximal, then the distal, and that too from lateral to medial side. ये बहुत important है. पहले proximal 4 carpals, then distal 4 carpals, and from lateral to medial side, and it will be from lateral to medial side. So some lovers try position that they can't handle. Okay, so S for scaphoid, L for lunate, and यहाँ पे T for will be triquetrum, okay, P for pisiform, and यहाँ पे there will be trapezium and trapezoid. So अगर आप देखोगे तो Z तक सेम है. अब alphabetically I and O में से I comes first. Okay, I and O में से the I comes first. Okay, so trapezium will come first, that is more laterally. Then there will be trapezium, then there will be trapezoid, then C for capate or capitate, okay, C and H बच गया था, तो C for capitate and H for hamate. Okay, now most common and the most important wrist injury is your scaphoid fracture, and we have read it multiple times ki scaphoid fracture is very important because of high chances of avascular necrosis or the osteonecrosis. Three bones have femoral head, the scaphoid and the talus. Okay, so scaphoid fracture, and iske liye dekhne ke liye you have to get a special view which is the oblique view to clearly visualize the scaphoid, and it is most commonly in the young adult age group due to fall on an outstretched hand etc. And clinical features same होता है, बस इसमें ध्यान रखना pain is characteristically radiating or present in the anatomical snuff box. Okay, anatomical snuff box, and इसके diagnosis is somewhat difficult because it is very hard to appreciate the scaphoid fracture. So if you are doubting a scaphoid fracture, you have to go for the serial x-rays like after every 3 to 4 days or every 7 days, and then you can appreciate the scaphoid fracture. Okay, now anatomical snuff box you will read in the anatomy. यहाँ पे relevance मैंने बता दिया, and we will discuss the contents and the boundaries. Okay, तो सबसे पहले medially this is your anatomical snuff box. So medially there will be tendon of the extensor pollicis longus. Laterally there will be tendon of extensor pollicis brevis and abductor pollicis longus. Okay, proximally there will be styloid process, and floor pe there will be carpal bones etc. Contents very important. Contents mein there will be one artery, that is the radial artery, one vein, that is the cephalic vein, and one nerve, that is the superficial branch of the radial nerve. These are the contents of the anatomical snuff box. Okay, here you can see in the image the anatomical snuff box. Okay, so now we'll come to the scaphoid cast. So scaphoid cast is also called as the glass holding cast, and same hota hai below elbow, like the uh, Colles cast, below elbow cast, palmar flexion. But instead of ulnar deviation, here you will have the radial deviation. Instead of ulnar deviation, you will have the radial deviation, and if the displacement is zyada, you have to go for the open reduction internal fixation with the screw called as the Herbert screw. Okay, and एक और difference होता है, below elbow तो होता है, but here you will cast this entire thumb like this. This is your scaphoid cast. Okay, oblique view we have already discussed, treatment we have discussed. Okay, now complications, avascular necrosis, and इसके treatment में you have to go for the excision. It is the treatment of choice for the avascular necrosis of the scaphoid bone. Okay, delayed and non-union can occur. Okay, and treatment we have discussed, wrist osteoarthritis, very common complication. Okay, and you go for the physiotherapy, exercises, hot fermentation, etc. So here you can see this is avian of scaphoid. Okay, now as I've told you many times that scaphoid ke there are three parts. Okay, there are three parts of the scaphoid: proximal 1/3, the middle 1/3, and the distal 1/3. Proximal 1/3 is called as your pole, distal 1/3 is called as your tubercle, and middle 1/3, and to be more specific, the junction between the proximal and the middle 1/3 is called as your waist. Okay, now most common site for fracture is your waist, and kahin pe bhi fracture ho, the most common site for the avian or the avian will start from the pole or the proximal 1/3 part of the scaphoid. Okay, it is very important, just remember this. Okay, you should not forget it, it is important. Now we'll come to the lunate dislocations. Okay, so dislocation mein lunate dislocations of the wrist are मोस्ट कॉमन. इसमें दो टाइप के डिसलोकेशंस होते हैं. फर्स्ट इज ल्यूनेट डिसलोकेशन, सेकंड इज अ पेरी ल्यूनेट डिसलोकेशन. तो ल्यूनेट डिसलोकेशन में क्या होगा, only the lunate will be dislocated, rest all carpal bones will be in the normal anatomical position and most commonly in the anterior direction. Whereas in perilunate dislocation, only lunate will be in the normal anatomical position, baki the rest all carpals will be dislocated, mostly dorsally, that is posteriorly. ट्रीटमेंट, यू ट्राई क्लोज रिडक्शन, अगर नहीं आता है देन यू गो फॉर द ओपन रिडक्शन, एंड ऑल्सो देर आर हाई चांसेस ऑफ avascular necrosis of the lunate. Okay, here you can see this is your scaphoid lunate and there is this dislocation, and here you can see this is your lunate dislocation because only lunate is dislocated, rest all are in normal anatomical position, and this is called as the Terry Thomas sign. Okay, this is a Terry Thomas sign, and the scaphoid will show a signet ring sign with increased space between the scaphoid and the lunate called as the Terry Thomas sign. Okay, now we'll come to boxer's fractures. Boxer's fracture is nothing but fracture of the fifth metacarpal ki neck of the fifth metacarpal, generally displaced, though the treatment of choice is your K-wire fixation either by closed reduction or open reduction. And there are two types of fractures. First is your Banate fracture, you should remember them also, Banate fracture and your Ronaldo fracture. Okay, so Banate is a fracture dislocation, दोनों में ही first metacarpal base are involved, that is thumb. फर्स्ट मेटाकार्पल बेस यानी थंब के बेस का फ्रैक्चर होता है. बेनेट्स इज इंट्रा आर्टिकुलर फ्रैक्चर विद डिसलोकेशन ऑफ द कार्पो मेटाकार्पल जॉइंट. Okay, whereas Ronaldo fracture is extra articular fracture with no involvement of the carpometacarpal joint. Okay, this is important, remember this. Now this is your mallet finger. So mallet finger is like this, where there will be flexion at the DIPC. This is your distal interphalangeal joint. This is your proximal interphalangeal joint, and this is your metacarpophalangeal joint. Okay, now there will be flexion at the DIP due to inability to extend the fingers at the DIP due to injury to the extensor टेंडन्स जो यहाँ पे डिस्टल फैलेंक्स पे अटैच होते हैं. ओके, नाउ इसका उल्टा होता है, दैट इज योर jersey finger. Okay, in jersey finger the patient will be unable to flex because there will be injury to the attachment of the flexor tendons at the DIP, and इसमें भी most commonly the tendon of the flexor digitorum profundus का avulsion होता है. This is your jersey finger. Okay, here you can see this is your jersey finger where flexion of this finger will not be possible. Most commonly it is of the index or the ring finger, या तो इंडेक्स फिंगर का होगा या रिंग फिंगर का होगा मोस्ट कॉमनली. Okay, now another very important is your trigger finger. What happens is that the flexor tendons of the phalanges go into form this tendon, and they form the pulley. Okay, the flexor tendons, they go into a pulley. Okay, and this pulley holds the flexor tendon, but sometimes the starting mein there is a knot at the pulley, and there is thickening and formation of this tunnel, so the flexor tendons are fixed inside this, so your finger will be like this. Okay, in trigger finger like this, है ना. So but in the initial stages, if you will manipulate yourself, and with manipulation you will be able to bring back the finger to normal anatomical position, and normal movements will start. So physiotherapy and all this will help initially, and a corticosteroid injection etc intralesional. But agar if you are not able to relocate the trigger finger, or the pain is very severe, then you have to go for the surgery also. Okay, so we have discussed the jersey finger, we have discussed the, now we'll discuss the jammed finger. Jammed finger is nothing but any traumatic finger जो कुछ time के लिए bruising होके swelling and they become jammed because there is no injury, no movement possible due to injury and pain. Okay, and cold fermentation analgesics say within 3 to 4 days it becomes okay. So this is your jammed fingers. Now claw hand are of two types. Partial claw hand if there is only ulnar nerve injury, but ulnar nerve and median nerve दोनों होती है, then it is called as the complete claw hand like this, ulnar plus median nerve both. Okay. Now what is stored finger? Stored finger is PIP joint पे if there is hyperextension of the joint जिसकी वजह से dislocation हो जाए, this is your stored finger. Now Dupuytren's contraction, it is a flexion deformity basically of the ring finger and the little finger. Ring finger and little finger से start होता है. This is your Dupuytren's contraction. You can feel the contracture or the cord like structures here. Okay, this is your Dupuytren's contracture, remember this. Now very important is your gamekeeper's thumb or the skier's thumb, and there is injury to the ulnar collateral ligament. Okay, gamekeeper's thumb or the skier's thumb due to the forceful abduction. Okay, if the pressure is like this, okay, like this, okay, there will be forceful abduction here, there will be forceful abduction which will lead to the skier's thumb or rupture of the ulnar collateral ligament with the avulsion fracture or a chip fracture of the first metacarpal head. Okay, or the metacarpophalangeal joint. This is your gamekeeper's thumb or the skier's thumb. Okay, tennis elbow, lateral epicondylitis we have discussed. Medial epicondylitis, golfer's elbow called as the suitcase elbow, we have already discussed. Okay, and pitcher's elbow. Pitcher's elbow is again in the medial plane, that is the medial epicondyle में होता है. Okay, this is your pitcher's elbow. Okay, inside is your medial side, that is your pitcher's elbow. Outside is your lateral side, that is your tennis elbow. Carpal tunnel we have already discussed. Pronator teres syndrome क्या होता है? If this median nerve is compressed under the pronator teres, this is called as pronator teres syndrome, जिसमें same median nerve वाले compression के symptoms आएंगे. There is pain, numbness, tingling at the thumb, index and the middle fingers. But इसके साथ में क्या होगा? There will be more pain at the pronator teres side, that is at the pronation and the forearm maybe. Okay, there, this is the differentiation between the carpal tunnel and the pronator teres syndrome. Salter-Harris classification we have already discussed. Carpal bones we have already discussed. Okay, this is your flexor retinaculum or the transverse carpal ligament or the anterior annular ligament, and iske niche there is median nerve. Okay, uh, which we have discussed, this is your Ronaldo fracture, extra-articular base of first metacarpal. This is your skier's thumb or the gamekeeper's thumb. These tests we have already discussed. Okay, now we'll come to this deformity of the fingers, which is very important. Okay, deformities of the fingers which are very important. Okay, so mallet finger we have already seen. Swan neck and bottomless deformity. So remember this swan neck पे क्या होगा, there will be flexion at the PIP, DIP, flexion at the DIP like the mallet finger, but with hyperextension at the PIP. Whereas in bottomless deformity, there will be flexion at the PIP and hyperextension of the DIP. This is your Bottomless deformity. Just remember the picture, take the screenshot of such pictures and revise them in 10 to 15 days में अगर ऐसी 50 images देखने में you will not take more than 10 to 15 minutes. Okay, so this is the best way to remember and revise. Okay, क्योंकि अगर if you think कि मैंने आज पढ़ा है और कितने भी अच्छे से पढ़ लो and after 3 months I will remember them exactly without any doubt, it is not possible. Okay, so that's why frequent revision and best way is to just see the images. Okay, so this is your Bottomless deformity or the swan neck deformity. Okay, now we'll come to the peripheral nerve injuries. Okay. uh, I guess there is some. Okay, yes, there is some problem with my internet connection. Let me check it. Is the video proper? Is it lagging or something? Can anybody give me a thumbs up if the video is normal, if there is no lag and or if I'm audible? Okay, so yes, I think it is good. So peripheral nerve injuries में, so peripheral में nerves, they are called the fasciculars because they are group of the nerves. So the group forms like this. So the outermost covering is your epineurium. Okay, fibrous covering, and inside epineurium there are many groups of neurons, and these groups are in a bundle which is covered by the perineurium. So epineurium के अंदर you have the neurons with its vessels also, whereas in perineurium vessels will not be included. तो epineurium, उसके बाद में perineurium, and individual neurons की जो covering होती है that is called as the endoneurium. Okay, and this entire perineurium का जो coverage होता है, इसमें जो बहुत सारे neurons होते हैं, it is cumulatively called as the fasciculus. It is called as the fasciculus. Okay, So peripheral nerves spinal cord से आती है, arise from the spinal nerves. 31 pairs of spinal nerves है, and peripheral nerves are mixed nerves which carry the motor as well as sensory plus the autonomic, that is sympathetic supply also. Okay, now motor innervation of the limb muscles को should be known so that you can assess whether the nerve is injured or not, or what are the functions of this nerve, etc. Okay, and what the sensory innervation जो होता है इसमें ध्यान रखना कि if there is a single muscle, that single muscle will be supplied by more than one sensory nerve. Okay, but there is some special area, small areas which are solely and solely dependent for a individual nerve for the sensation of that part of the muscle, and that is called as the autonomous zone. Okay, now the anatomical features जो होते हैं, या what are the areas, या what are the causes which can lead to the injury of the nerves. If there is any injury in relation to the surface, like flexor retinaculum के just नीचे median nerve होती है, okay, और median nerve is comparatively superficial at the wrist joint. Relation to the bone, जैसे shaft of humerus fracture में radial nerve injury is more common. Relation to the fibrous septa, ki sometimes there is compartment syndrome or there is hypertrophy or pressure at the fibrous septa which can lead to the entrapment neuropathies. Or sometimes with any injury to the major vessels there can be associated injury to the nerves also, because vessels and nerves they mostly travel in a bundle साथ में. Okay, so these are the various causes. Now pathology में if there is any nerve injury, then what will happen, सबसे पहले there will be healing. So healing is by the primary degeneration or the secondary degeneration. So primary degeneration, P for proximal, so the proximal part will undergo the degeneration in the proximal direction, that is the retrograde direction. That's why it is called as the retrograde degeneration. Whereas very important is the secondary degeneration, which is called as the Wallerian degeneration. Okay, and this Wallerian degeneration is at the distal point. Okay, now nerve regeneration. Nerve regenerate but very slowly. So nerve regeneration में क्या होता है, the proximal segment, that is near to the cell body वाला part, वहाँ से distally there is regeneration of the axon and it will form the axonal stump, है ना. And generally क्या होता है, these axonal stumps attach with each other and they form the intact Schwann cells and the neurilemma, neurilemma. But if these axonal stump is interrupted, it may form a end neuroma like this. Okay, so this is neuroma in continuity. Injured segment are joined, but if they are not joined, it is called as the end neuroma. Now motor march, it is important for examination point of view. You will you must have read it in the physiology that the rate of recovery or the rate of nerve regeneration is 1 mm per day. Okay, and muscle which is nearest to the site of the injury will recover earliest or recover first, then the muscles towards the periphery, and this is called as the motor march. And in this motor march को assess करके you can assess the regeneration or healing of any nerve injury. Now nerve के लिए classification is very important, that is your Seddon's classification. Okay, remember बहुत important classification है, very frequently asked is your Seddon's classification, which classify nerve injuries into three types: neuropraxia, axonautomesis and neurotomesis. तो न्यूरोप्रैक्सिया में क्या होगा, there will be no as such physical injury or cut in the neuron, so the prognosis is very good, healing is complete, There is no structural changes, recover spontaneously without any treatment, and complete recovery हो जाती है in few weeks. In axonotomesis, there will be structural changes, or there will be cut or injury to the axon. Okay, so axons are damaged, but the internal architecture of the nerve, that is the cell body or etc., is preserved. Okay, so here recovery will occur. It will take more time. Spontaneous recovery may take up to months, but it will be incomplete recovery. Okay, and also there is injury, so there will be degeneration, and most commonly Wallerian degeneration. Neuratomosis नाम से पता चल रहा है the entire nerve is damaged, the entire structure of the nerve is damaged, so here there will be no recovery. Okay, there will be no recovery, very poor prognosis होता है इसका, and generally you need to go for the surgery or the nerve repair. Okay, and here also Wallerian degeneration occurs most commonly. Okay, so this is your Seddon's classification, very important. Now we'll come to the individual nerves. इसमें first we'll start with the radial nerves. Okay, firstly we'll start with the radial nerve. Okay, so radial nerve, इट इज फ्रॉम द ब्रेकियल प्लेक्सस के रेडियल नर्व आते ही आपको एक चीज याद रखनी है, दैट इज पोस्टीरियर. इट अराइजेज फ्रॉम द posterior cord. Okay, it supplies the posterior aspect of the forearm, that is the extensor compartment of the forearm. Okay, posterior cords होता है C5, C6, C7, C8 and T1. Okay, and it starts from the arm, and सबसे पहले it will give supply to the triceps. triceps के तीनों head को radial nerve supply करती है. Okay, so the posterior compartment of the arm, that is the triceps, is also supplied by the radial nerve. Okay, so it will give first branch to the medial head of the triceps and posterior cutaneous branch. Then it will come into the radial groove on the humerus bone at the posterior aspect, and it will go down on the posterior surface, and there it will give two branches. First branch will be again to the triceps, this time the lateral head, enconeus muscles, and a cutaneous branches for the arm and the forearm. Then at the lower part, after winding around the humerus, nerve will pierce at the lateral aspect. Okay, radial nerve है तो lateral side में होगी, intermuscular septum, and it will come in the anterior compartment between the brachialis and the brachioradialis, and very importantly is that lateral condyle के relation में होगी, lateral part में होगी, and it will cross the elbow joint from in front, क्योंकि posterior थी, posterior से wind round होके brachialis radiobrachialis के बीच में होके anteriorly आ गई, so it will cross the elbow, from the front. Okay, that is from the anterior aspect of the lateral condyle, and then it will divide into two branches, deep branch and the superficial branch. Superficial branch will be only sensory branch. Okay, and the deep branch will be the motor branch, which will supply to the extensor compartment of the forearm, the extensor carpi radialis brevis and the supinator सबसे पहले. Okay, extensor carpi radialis brevis and the supinator सबसे पहले, and in the forearm it will then divide into posterior interosseous nerve. Remember, posterior interosseous nerve is a branch of radial nerve, whereas anterior interosseous nerve radial nerve की branch नहीं होती. किसकी होती है वो अपन आगे देखेंगे. So posterior interosseous nerve में convert हो जाएगी, and then it will supply the posterior interosseous nerve की help से the extensor tendons of the forearm. Okay, so triceps, all three heads, enconeus, elbow पे brachioradialis, extensor carpi radialis and the supinator. and it will supply all the extensors of the forearm and one this abductor pollicis longus. Okay, so this is the uh, test. Now test जो होती है उससे पहले you need to remember two things, that is high radial nerve palsy and low radial nerve palsy, और ये हर nerve के अंदर होगी, like high median nerve, low median nerve, high ulnar nerve, low ulnar nerve palsy. So what is high radial nerve palsy? अगर injury to the radial nerve is above the elbow, that is called as the high ulnar nerve palsy, that is most commonly into the radial groove due to the fracture of shaft of humerus. And in this case क्या होगा, all the muscles will be paralyzed except the muscles which are supplied at the proximal part, that is the triceps and the anconeus. Okay, and अगर at the entry of the arm में इंजरी हो जाती है, which is called as the very high radial nerve palsy, तो उसमें triceps and anconeus will also be पैरालाइज्ड. इन लो रेडियल नर्व पाल्सी में बिलो द एल्बो होगा. सो कौन कौन सी मसल्स बच जाएगी? द मसल्स विच विल नॉट गेट इनटू द पाल्सी विल बी द ट्राइसेप्स, the anconeus and the brachioradialis extensor carpi radialis longus and the brevis. These muscles will be intact because इसके बाद it will convert into the posterior interosseous nerve and will supply the remaining extensors. So this is your low radial nerve palsy. Okay, this is your low radial nerve palsy, and इसके हिसाब से there will be the differentiation. So वो आप easily you can remember this. So we'll discuss them. Proximal to the proximal forearm or the elbow, लो रेडियल नर्व डिस्टल होगी. रेडियल नर्व प्रॉपर इंजरी होगी, इसमें देयर विल बी इंजरी टू द सुपरफिशियल ब्रांच ऑफ द रेडियल नर्व और द पोस्टीरियर इंट्रोशियस नर्व. सो एल्बो का एक्सटेंशन will be present in case of low radial nerve injury. Wrist extension यानी wrist drop, wrist extension and finger extension will not be possible, so there will be complete drop. Whereas in low radial nerve palsy, very weak wrist extension can be done. Okay, now individual muscles जो supply होती है radial nerve से, you need to know the test and functions of these muscles so that you can diagnose the it clinically कि कौन सी nerve की palsy. तो सबसे important into triceps. So triceps is in the posterior compartment of the arm. Okay, so the patient is asked to extend the elbow क्योंकि इसका काम होता है elbow का extension. So if the extension of the elbow is possible like this against the resistance, then the triceps the triceps muscle is intact. ब्रेकियोरेडियालिस को चेक करने के लिए सेमी फ्लेक्स्ड एल्बो में you keep the forearm in prone position, and against the resistance, if you will give the resistance like from the wall, you can feel the muscle. Same with the triceps also, extend करते time you can feel the triceps, whereas इस position में you can feel the contractions in the brachioradialis. Or if you cannot feel the contraction, then there is brachioradialis palsy. Wrist extensors, wrist drop, so you will not be able to extend the wrist and the fingers. Ab remember कि there will be, it will be like this, there will be finger drop, but only the extensor digitorum is affected. Okay, so there will be drop at the metacarpophalangeal joint, not at the interphalangeal joint. Okay, so ये ध्यान रखना, जो इंटरफेरेंजियल जॉइंट पे एक्सटेंशन होता है that is due to lumbricals which are not supplied by the radial nerve. Okay, so you should remember that the extension at the interphalangeal joint will be there, and also of the fingers, but interphalangeal joint of the thumb is uh, extension is by the extensor pollicis longus, not the lumbricals. Okay, so there will be no extension at the interphalangeal joint, no extension at all the metacarpophalangeal joint, but there can be extension at the interphalangeal joint of the fingers due to the lumbricals. Okay, this is your brachioradialis ka testing. This is the test for the brachioradialis muscle. Yes, extension of thumb will be affected. Okay, now radial nerve injury को different name से भी जाना जाता है. You just need to remember the name. Saturday night palsy, overdrunk की वजह से, honeymoon palsy, handcuff neuropathy, crutch palsy or the squash palsy. All these are names of the radial nerve injury, and इसके लिए you have the radial nerve brace, which is called as the this is your cock-up splint, and this is your dynamic cock-up splint. Okay, where you can adjust the movement. So this is your dynamic cock-up splint. Okay, now which nerve supplies the which area, which will we will see in the last. Okay, we will see in the last. Okay, now median nerve, the nerves, the root value is C6, 7, 8 and T1. Okay, it is a branch of the brachial plexus from the lateral and the medial cords along, and it travels along the brachial sorry, travels along the brachial artery. Okay, now median nerve जो है, it supplies all the muscles of the flexor compartment and the two heads of the pronator teres also, and the pronators also. Okay, so all the heads of all the flexor tendons except two, that is your flexor carpi ulnaris and the medial half of the flexor digitorum profundus. ओके, इनको मीडियन नर्व सप्लाई नहीं करती है. ओके, सो नर्व एंटर्स द फोरआर्म बिटवीन द टू हेड्स ऑफ द प्रोनेटर टीरेस. It passes deep down forearm में, it is between the flexor digitorum superficialis and the profundus, and in the elbow it again goes superficial just beneath the flexor retinaculum. Okay, just beneath the flexor retinaculum, where it enters the palm, and then it gives branches to the thenar eminence. So very important, median nerve flexor compartment को forearm में and hand के अंदर it supplies the thenar muscles. Okay, or muscles of the thenar eminence of the thumb, and hypothenar is of the little finger, thenar is of the thumb. This is your thenar, this is your hypothenar. The thenar eminence or thenar muscles को supply करती है median nerve, and there are three muscles, that is abductor pollicis brevis. Okay, abductor pollicis longus supplied by the radial nerve, abductor pollicis brevis, opponens pollicis, and the flexor pollicis brevis. Okay, and the flexor pollicis brevis. So ऐसे याद रखो, LMAO, lemao, supplied by the median nerve. So L for lumbricals, that to the first two lumbricals. Okay, A for abductor pollicis brevis, and O for opponens pollicis. Okay, and first and second lumbricals also, first and second lumbricals also. So except the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. Test दो टाइप का होता है. If it is above the elbow, high median nerve palsy, below the elbow, low median nerve palsy. Okay, तो इन लो मीडियन नर्व पाल्सी फोरआर्म मसल्स जो होगी, यानी कि फोरआर्म के अंदर जो फ्लेक्सर मसल्स होगी, दे विल बी स्पेयर्ड, वेयर एज इन हाई मीडियन नर्व पाल्सी फोरआर्म मसल्स विल also be affected. Now how will you examine the individual muscles? सबसे पहले ये flexor pollicis longus. So flexor pollicis longus supply the thumb. Flexor pollicis longus supplies the thumb that to the distal part, the terminal phalanx of the thumb against the examiner. So ऐसे करके you cannot test like this. You have to keep this proximal phalanx steady. So this is your flexor pollicis longus. Now flexor digitorum superficialis and flexor digitorum profundus का lateral half is supplied by the median nerve. So the characteristic sign of median nerve palsy is your pointing index, also called as the Ochsner's clasp index. So normally you can do like this, okay, but in case of median nerve palsy it will be like this. The index finger will remain straight, okay. And अब आप बोलोगे कि अदर फिंगर्स क्यों फ्लेक्स हो पा रही है? The other fingers can be flexed due to the action of the medial half of the flexor digitorum profundus, which is supplied by the ulnar nerve. Now flexor carpi radialis, it can be tested hold the wrist in the flex position, and if the flexor carpi ulnaris is there is palsy of the median nerve, so there will be no function of the flexor carpi ulnaris. So on flexing the wrist it will deviate towards the ulnar side, okay. So on palmar flexion the wrist deviate towards the ulnar side. That means there is no motor supply for the flexor carpi ulnaris. Now thenar eminence में only two muscles को आप test कर सकते हो, that is the abductor pollicis brevis and your opponens pollicis. Opponens pollicis is like this, okay. This is the opponens pollicis का function, that is the opposition of the thumb. Now abductor pollicis brevis is to make the thumb like this, okay, like this. This is your action of the abductor pollicis brevis, okay. So इसके लिए को test करने के लिए you have the pen test which was there in the NEET PG 2021 examination this year. Pen test ka diagram based question was there, okay. So this is your pen test for the abductor pollicis brevis supplied by the median nerve, okay. Normally you will be able to touch the pen like this. This is your pen test, but in case of median nerve palsy, abductor pollicis brevis will not work, so you will not be able to touch the pen. This is your pen test, okay. This is your flexor pollicis longus of the thumb ka terminal phalanx ka Ochsner's clasp index. This is your flexor carpi radialis ki testing. On palmar flexion there will be ulnar deviation, okay. Now on the median nerve ki supply we have already discussed 1 2 3 and this half finger. So and thenar eminence ki muscle, so there will be atrophy and wasting of these muscle, and this will lead to the formation of the this ape hand, okay, ape hand. And now there will be sign of benediction because these three fingers will not be able to flex completely. So this is your benediction hand, this is your hand of benediction like this, okay. नाउ आप बोलोगे कि क्लॉ हैंड भी है, तो इसको आप कैसे डिफरेंशिएट कर सकते हो? इन केस ऑफ हैंड ऑफ बेनेडिक्शन यू कैन बी able to extension and flexion both will be possible, okay. But in case of claw hand it will be permanently flexed, okay. And this will be your hand of benediction in case of median nerve injury, okay. So those nerves, okay. Now we'll come to the last important nerve of the upper limb, that is your ulnar nerve, which is C8 to T1, and it is from the medial cord of the brachial plexus. It is from the medial cord of the brachial plexus, and it runs in close proximity on the medial side of the axillary artery. So it will enter the forearm by piercing the medial intermuscular septa, but radial nerve was in front of the lateral condyle. It will in the back, yani it lies behind the medial epicondyle. Okay, then in the forearm it will travel between the two heads of the flexor carpi ulnaris. Okay, and it will supply two muscles in the forearm, that is your flexor carpi ulnaris and your medial half of flexor digitorum profundus. Okay. Pisiform is your medial most carpal, so just lateral to the pisiform there will be ulnar nerve. Okay, and in the palm it will divide into the superficial and the deep terminal branches. So it will supply the hypothenar muscles in the hand. It will supply the third and fourth lumbricals, and it will also supply the palmar and the dorsal interossei. It will also supply the palmar and the dorsal interossei muscles. Now remember, pad means palmar interossei muscle is related to AD, that is adduction. Okay, so this is adduction due to palmar introssion. This is fanning abduction is due to the dorsal introssia. So इसलिए palmar introssia को check करने के लिए you have that card test. Remember, you have that card test to check the palmar introssia. Okay, so this is your card test to check the palmar introssia. Okay. Similar to the other nerves, elbow से ऊपर high ulnar nerve palsy, elbow से नीचे there will be low ulnar nerve palsy. Elbow से नीचे there will be low ulnar nerve palsy. Okay, test flexor carpi ulnaris, similar to the flexor carpi radialis. ही टेस्ट करेंगे palmar flexion, but यहाँ पे in case of palsy the wrist will deviate towards the radial side, so there will be radial deviation. Okay, there will be radial deviation. Abductor digiti minimi of the hypothenar can be checked by abducting the little finger against the resistance. Okay, like this, like this. Introssia में palmar introssia is tested by the card test, and the dorsal introssia is tested by the Igawa's test. Okay, card test we all know कि क्या होता है. This is your Igawa's test. But इसमें ऐसे नहीं कर सकते. Keep it, you have to keep it on a plane or on a table, then you can ask the patient to do the abduction like this. This is your Igawa's test. Sorry, for the dorsal introssia, and card test for the palmar introssia. The lumbricals का isolated action you cannot test. Okay, now adductor pollicis, it is an important muscle supplied by the ulnar nerve, and it supplies to the thumb. Okay, now normally what happens is that if you are holding a paper like this, okay, there is a paper. If you are holding a paper like this between the index and the thumb finger, you can hold it like this. Okay, you can hold it like this. Okay, but in case of ulnar nerve palsy, you will not be able to do the extension at this terminal phalanx. You can hold the paper, but you will have to hold the paper like this. This is called as your Froment sign. Okay, this is called as your Froment sign, seen in the case of ulnar nerve palsy. So this is your positive Froment sign. Okay, this is your positive Froment sign. Okay, क्या होता है, the adductor, the you will not be able to adduct the thumb, so you will be able to support, you have to able the support, you have to support the thumb by doing the flexion. So if the adductor pollicis is paralyzed, then the patient need to give the support by flexing the thumb. That is, he or she will hold the book using the flexor pollicis longus, which is supplied by the median nerve, because adductor pollicis का function होता है flexion at the interphalangeal joint. Okay, so this is your Froment sign. This is your flexor carpi ulnaris. Okay, types of claw hand we have already discussed. So the difference between claw hand and the hands of benediction, basic differences: claw hand, ulnar claw hand due to ulnar nerve, hand of benediction due to median nerve. Hand of benediction में the 1, 2 and 3 fingers will be affected. The ulnar nerve में 4 and 5 fingers will be affected. And other differences, these are the basic differences. Okay, इसके अलावा it is due to medial two lumbricals, it is due to lateral two lumbricals and the lateral half of the FDP. Okay, now other important nerves, इसमें एक एक दो दो लाइन जो important है we will discuss है. सबसे पहले accessory nerve. Accessory nerve supplies the trapezius muscle, and you test the trapezius muscle like this by asking the patient to elevate the shoulder against the resistance. He will be able to do this if the trapezius muscle or the accessory nerve is intact. This is your long thoracic nerve, also called as long thoracic nerve of Bailey. Okay, and it is C5, C6, C7, and it supplies the serratus anterior with, and if the serratus anterior is not working properly, there will be winging of the scapula, that is on the resistance. The medial border of the scapula will become prominent. This is your winging of the scapula in case of long thoracic nerve ki palsy affecting the serratus anterior. Axillary nerve, again a branch of the posterior cord which supplies the deltoid muscle. It is around the surgical neck. So इसके paralysis में there is this hypoesthesia here, which is called as the regimental badge sign. Okay, and इसमें भी deltoid is supplied by the anterior branch, whereas posterior branch supplies the teres minor and the skin over the deltoid. Okay, signs of regeneration: tunnel sign, motor sign, etc. This is your aeroplane splint like this, which is used for the deltoid paralysis or the axillary nerve palsy. Conservative treatment of nerve injuries by the splinting, like we are discussing turnbuckle, splint, etc. We have seen. Preserve mobility by physiotherapy and care of skin and nails. Okay, this is your cock-up splint, which we have already discussed. This is your ulnar nerve के लिए knuckle bender splint, and turnbuckle splint was for the Volkmann ischemic contracture, whereas knuckle bender splint if is for the lumbricals or the ulnar nerve palsy. Physiotherapy, operative treatment में you go for the nerve repair. Okay, now ये important है, prognosis of the nerve injuries is depend on certain factors, and sorry, and we will discuss these factors individually. Okay, these are dependent on certain factors. सबसे पहले age, it is prognosis is better at a lower age, yani in children the prognosis is good, टेंशन एट द सूचर लाइन, अगर टेंशन ज़्यादा होगा तो प्रोग्नोसिस विल बी पुअर। टाइम सिंस इंजरी, जितना कम चांस है उतना ही ज़्यादा अच्छा प्रोग्नोसिस होगा। लोकेशन ऑफ द इंजरी, the more proximal the injury, the poor is the prognosis. Type of the nerve, motor nerve has better prognosis than mixed nerve or a pure sensory nerve. So radial nerve have the best prognosis out of these three nerves. Condition at the nerve, and obviously if there is infection or more crushing, more severe injury, there will be poor prognosis. Okay, now what is this? This is your wrist drop due to radial nerve injury. This is your claw hand, partial claw hand due to ulnar nerve. Okay, this is your ape thumb, hand of benediction. Okay, this is your pointing index or the Osner's clasp index. All of this is seen in case of median nerve palsy or median nerve injury. Okay, so this was all about the entire upper limb की orthopedics. Now we will जल्दी से do some questions. Okay, बहुत easy questions रखे हैं मैंने, बहुत ही basic questions रखे हैं. So we'll discuss them जल्दी जल्दी से. I'll give you 10 seconds after every question to answer them and write in the live chat box. Okay, so let's start and jaldi se we'll do these questions. Okay, okay, so the first question is, Benedict fracture dislocation involves base of. Very easy, we have discussed this. It involves the base of first metacarpal. It is intra-articular and there is some injury to the carpo-metacarpal joint also. Okay, now a 4-year-old child presents to the clinic with a history of fall on an outstretched hand. Radiograph revealed a broken anterior cortex with an intact posterior cortex of the radius with an exaggerated bowing of the radius. The fracture sustained is. Here are your 10 seconds. ओके, गैलेजी फ्रैक्चर नहीं होगा, मॉन्टेजिया फ्रैक्चर नहीं होगा, दो इनकम्प्लीट फ्रैक्चर है, इट कैन बी टॉरस और ग्रीन स्ट्रिंग, बट बोइंग एंड that too at the shaft and the bowing, it is the characteristic feature of the green stick fracture, so the answer will be a green stick fracture. Whereas torus fractures are generally at the metaphyseal diaphyseal junction, and these are also called as the buccal fractures, the torus fracture. Okay, this is your torus fracture and this is your green stick fracture. Now, a 9-year-old child presents to a clinic with following deformity. Which is the most likely fracture leading to such a deformity? Here are your 10 seconds. Okay, so this is your cubitus varus deformity due to supracondylar fracture. Okay, cubitus varus or the gunstock deformity due to fracture supracondylar humerus. We have discussed everything about it. Okay, Now एक important चीज, supracondylar fracture of humerus are also called as the Malgagne's fracture. Okay, whereas Monteggia fracture is different, Malgagne's fracture is another. Okay, now this we have discussed in yesterday's class. वापस discuss करते हैं. Surgical neck of the humerus पे axillary nerve, deltoid muscle and regimental bed side. Shaft of humerus, radial nerve. Medial condyle of the humerus, ulnar nerve. Monteggia fracture dislocation में the posterior interosseous nerve, which is nothing but a branch of the radial nerve. Okay, so Monteggia fracture dislocation में most common nerve injured is your radial nerve or the posterior interosseous nerves. Volkmann ischemic contracture में you have the anterior interosseous nerve and the anterior interosseous artery most commonly affected. Lunate dislocation में you will have the median nerve, whereas hip dislocation में sciatic nerve as foot drop. Okay, remember this. Next question. A 6-year-old child has an accident and had a fractured elbow. After 4 years presented with tingling and numbness in the ulnar side of the finger. Fracture is. Here are your 10 seconds. Okay, so 4 years later यानी old fracture की वजह से there is tingling numbness on the ulnar side यानी ulnar nerve medial side. All these are features of the tardy ulnar nerve palsy, which is due to malunited lateral condyle fracture of the humerus. So answer will be lateral condyle fracture of humerus with cubitus valgus deformity. ठीक है. Commonest dislocation of elbow is, we have discussed, it is your posterior dislocation is the most common dislocation of the diagnosis is very easy. We have discussed this just now. 10 seconds. Okay, there is fracture of proximal 1/3 of ulna with dislocation of the radial head. So this is MUP, that is Monteggia fracture dislocation. Okay, so the answer is D, that is Monteggia fracture dislocation. A 2-year-old child is pinned around by his father. Suddenly, the child started crying and did not allow his father to touch his elbow, which is the most likely diagnosis. Very easy. Here are your 10 seconds. So the answer is your pulled elbow. The answer is your pulled elbow. Okay. True about supracondylar fracture of humerus is. For this, I'll give you 15 seconds. Here are your 15 seconds. ओके, सो लेट्स डिस्कस दिस. नीचे से स्टार्ट करते हैं. माल यूनियन में लीड टू डिनर फोक डिफॉर्मिटी. नो, इसके माल यूनियन में यू हैव द गन स्टॉक डिफॉर्मिटी. डिनर फोक डिफॉर्मिटी इज ड्यू टू कोलीज फ्रैक्चर. Volkmann ischemic contracture is the most common complication. No, most common complication is your gun stock deformity, that is your cubitus varus deformity or the malunion. Tight angle on a true AP, true anterior posterior view can help in assessment of fracture. Okay, most of you students have not read this much. Okay, so ऐसे questions को attempt करते time just give a question mark. It is the most common fracture around elbow in children. Yes, it is right. So you will be confused with these two options, but Go with your instinct. This is the right answer because kite's angle elbow पे is not helpful for the supracondylar fracture of the humerus. Okay, very important. So, but remember, kite's angle is for the ankle joint, not for the elbow. Capitulum ankle or the Bowman's angle, बस name याद रखना है. Capitulum angle and the Bowman's angle is for the elbow joint. Kite's angle is for the ankle joint. Okay. Now next question. A 6-year-old child presented with a valgus deformity at his right elbow since 3 years that is gradually progressive. He has history of cast applied for 6 weeks after fall on an outstretched hand 3 years back. The probable fracture was. Here are your 10 seconds, very easy. ओके वेल्गस डिफॉर्मिटी है एंड पुराना फ्रैक्चर की हिस्ट्री तो इट इज ड्यू टू माल यूनियन वेल्गस डिफॉर्मिटी विच इज ड्यू टू माल यूनाइटेड फ्रैक्चर ऑफ लेटरल कॉन्डाइल ऑफ द ह्यूमरस. ओके, most common type of elbow injury in children and adolescents, supracondylar fracture we know. Most common cause of supracondylar fracture of humerus is due to fall on an outstretched hand called as an hyperextension injury. Most common type of supracondylar fracture of humerus is extension type जिसमें posterior displacement होता है. Most common type of distal fragment displacement is posterior dorsal backward, that is the extension type. Most common type of displacement in flexion type is this scapula anterior. Most common complication of supracondylar fracture of humerus is a late complication, that is your malunion, that is your cubitus varus or the gunstock deformity. Least common complication is non-union. Most common deformity we have discussed. Most common nerve injured median nerve and उसमें भी कौन सा branch? It's anterior interosseous branch. Tardy ulnar nerve palsy, lateral condyle fracture. Most common cause of Volkmann ischemic contracture is your supracondylar fracture of humerus. Most common cause of Volkmann ischemic compartment syndrome in children is again supracondylar fracture of humerus. Most common site of myositis ossificans elbow. Most common muscle involved in VIC flexor compartment की and इसमें भी कौन सी flexor digitorum profundus. Remember this. Okay. First sign or the most common sign of VIC is your pain. Very important. Most common nerve involved is VICA is median because we have just now checked ki most common vessel is your anterior interosseous artery and उसके साथ में anterior interosseous nerve which is branch of the median nerve. Okay, now most common nerve involved in anterior shoulder dislocation, it is your axillary nerve. Okay, most common nerve involved in surgical neck, again axillary nerve. Shaft of humerus, radial nerve. Medial condyle of humerus, ulnar nerve. Montagia fracture dislocation we have just now seen. It is the posterior interosseous nerve which is branch of the radial nerve. Scaphoid lunate dislocation में median nerve we have discussed. Hip dislocation, sciatic nerve, foot drop. Knee dislocation में common peroneal nerve present as foot drop. Best prognosis after nerve repair, it is of the radial nerve because it is purely motor. Worst prognosis is of the sciatic and the femoral nerve. Okay, these are the common points that you should remember. The following images show. Okay, very easy, 10 seconds, बहुत easy question है. Okay, so it is fracture of supracondylar humerus. Okay, and इसमें भी here you can see in AP view and in lateral view you can see anterior posterior displacement. Distal fragment is displaced posteriorly dorsally, so it is an extension type. It is of extension type, remember this. Okay, fracture shaft of humerus is associated with nerve damage. बहुत बार discuss कर लिया, it will be the radial nerve. Okay, terrible triad of elbow is, here are your 10 seconds. टेरिबल ट्रायड ऑफ एल्बो में तीन चीजें आती है, दैट इज एल्बो डिसलोकेशन विद रेडियल हेड फ्रैक्चर एंड द कोरोनॉइड प्रोसेस फ्रैक्चर ऑफ द अल्ना. दिस इज योर टेरिबल ट्रायड ऑफ द एल्बो. ओके, which of the following in 3-point relationship is maintained? We have discussed this. Here are your 10 seconds. It is maintained in case of fracture, supracondylar fracture of humerus. Okay. Bandage shown in photograph, we have seen the photo. It is used in fracture of, it is used in fracture of clavicle. It is a figure of 8 bandage. Okay. Classification shown in photograph was given by, this is epiphyseal injury का Salter Harris classification. Now what are the other classifications? Sanders classification, important, it is for the calcaneum. Okay, Cerny classification is for the soft tissues injury. Cerny classification is for the soft tissue injury, and the vessel classification is for the polydactyly. ओके, इसमें से इंपॉर्टेंट इज अ सेंडर्स क्लासिफिकेशन. ये आपको याद होना चाहिए कि सेंडर्स क्लासिफिकेशन इज फॉर द कैल्केनियम. नाउ डिफॉर्मिटी विद डिक्रीज्ड कैरिंग एंगल इज, हियर आर योर 10 seconds. It is your cubitus varus deformity. Okay, it is your cubitus varus deformity. Tennis elbow is, we have discussed this like twice or thrice already. Again, I'll give you 10 seconds. Tennis elbow is inflammation of the lateral epicondyle of the humerus. It is called as the lateral epicondylitis. Okay, it is called as the lateral epicondylitis. Okay. This is your Popeye deformity of the biceps tendon. Okay, and similar image was given in the year in which I had given the NEET PG. So NEET PG 2022 में 2020 में I clearly remember कि मेरे question paper में there was this question for the Popeye deformity. Okay, Finkelstein's test, impingement syndrome, we have all discussed this. Now next question is, amputation is often not required in, here are your 10 seconds. The answer is chronic osteomyelitis. May amputation is generally not required. In gas gangrene, diabetic gangrene, or the Buerger's disease, amputation is required. Most common nerve affected in condition is, here are your 10 seconds. Okay, so this is your Volksman ischemic contracture, and most common is the median nerve. Usme bhi it's anterior interosseous branch of the median nerve. Okay, the Putrins contracture can be caused by, here are your 10 seconds. The Putrins contracture can be caused by all of the above: diabetes, alcoholism, aptoin, etc. Okay, phenytoin, etc. Mallet finger is, we have discussed this, here are your 10 seconds. Mallet finger is flexion deformity at the DIP due to injury to the extensor tendons, avulsion injury to the terminal phalanx due to sudden pull of an extensor tendon. So answer is A. Okay, we have discussed these all. Phalanx sign is seen in, very easy. We have discussed this. Here are your 10 seconds. Phalanx sign is seen in carpal tunnel syndrome. Which of the following is true regarding mallet finger? Again, mallet finger pe question. Here are your 10 seconds. Now, treatment is open reduction, internal fixation. No. Contraction deformity of the flexor tendon. No. Okay, there is no contraction deformity. There is avulsion injury at the extensor tendon. So there is rupture of extensor tendon here. Yes, the answer is B. Also known as badminton finger. No. Okay. A 25-year-old बैडमिंटन फिंगर इज ट्रिगर फिंगर को भी बैडमिंटन फिंगर बोलते हैं. ओके, 25-year-old male comes to his physician for a follow-up visit with weakness of his right hand. 2 months ago, he suffered a motor vehicle accident in which his right hand was affected. On examination, he is unable to flex the metacarpophalangeal joints of the ring and the index finger. Ring and the index finger के metacarpophalangeal joints को he is unable to flex and unable to adduct the same fingers. Which of the following muscles are most likely paralyzed? Here are your 10 seconds. Okay, so the answer is palmar interossei. Very easy. Pad से याद रख लो. Adduction is for by the palmar interossei, and also they help in the flexion at the metacarpophalangeal joints. Okay, so palmar interossei. Most common bone to get fractured in fall on an outstretched hand is A, B, C, or D. So very easy. B, lower end of the radius, that is the Colles fracture. Now, it is a good question. You are posted as an intern in casualty. Which of the following patients with fracture will your first priority to call orthopedic postgraduate and inform? Okay, urgent priority कौन सा होगा इन सब में से? Here are your 10 seconds. तो प्रायोरिटी फर्स्ट इज एनी लाइफ सेविंग थिंग, इनमें से कुछ भी लाइफ सेविंग नहीं है. सेकंड इज अ लिम्ब सेविंग, दैट इज न्यूरोवास्कुलर इंजरी. ओके, यहाँ पे वैस्कुलर इंजरी हो है, that can be due to vessel cut or compartment syndrome due to compression of the vessel. Can't extend his arm, nerve injury हो सकती है. Abrasion not an emergency. Intra-articular fracture not an emergency. अब इन दोनों में से obviously it can lead to the amputation and the gangrene of that affected limb. So the emergency will be, our first priority will be, patient's finger is blackening. Okay. After a brawl, a young male presented with inability to extend his distal interphalangeal joint. An X-ray was taken and was shown to be normal. What should be the next step in managing? So it is a mallet finger. So there is injury to the extensor tendon, and X-ray is normal, means there is no bony injury. So you will just go for the splint. Okay, so the answer will be your splint. Mallet finger, also called as the baseball finger. Okay, Allen's test for integrity of palmar archer tests which of the following? So we do Allen test for the palmar arches, and we test both radial as well as ulnar nerve like this. Okay, this is your Allen's test. Which of the following bones are involved in wrist joint formation except? Okay, here are your 10 seconds. Very good question. Okay, so the answer for this question will be B, ulna. Okay, और इसको ऐसे याद रख लो कि we have discussed कि this distal end of the ulna or the proximal femur is not required for any functionality. So that's why answer will be ulna, the distal end of the ulna. Okay, remember ulna is not part of the synovial ellipsoid radiocarpal joint. First sign of compartment syndrome is, here are your 10 seconds. First sign and the most pathognomic sign is your pain. Pain is excessive, not controlled by the analgesic, out of proportion pain होता है. Okay, and remember pulse के basis पे कभी भी compartment syndrome को define नहीं करना. Okay. Congenital elevation of scapula is called as, we have discussed it in yesterday's class, I guess. No, yesterday से पहले वाली class, but we have discussed this. This is called as your Tringle shoulder. Okay, congenital elevation of the scapula due to inability of the descent of the scapula. This is called as your Springle shoulder. Okay. A patient presented with history of fall on an outstretched hand. There is pain and swelling over the radial aspect of the wrist without any obvious deformity. Radial styloid process is at a lower level than the ulnar styloid process. Tenderness elicited in the anatomical snuff box. Findings are consistent with the diagnosis of. Here are your 15 seconds I'll give you for this question. ओके, फॉलन आउटस्ट्रेच्ड हैंड रेडियल एस्पेक्ट पे है, सो स्केफॉइड फ्रैक्चर हो सकता है, कोलीज फ्रैक्चर हो सकता है. ठीक है। रिस्ट ऑस्टियोआर्थराइटिस नहीं होगा। पिसिफॉर्म इज ऑन द मीडियल साइड, सो नहीं। अब इन दोनों में से फर्स्ट ऑफ ऑल नो ऑब्वियस डिफॉर्मिटी है, पेन एनाटॉमिकल स्नफ बॉक्स में है। ओके, so and radial styloid is the lower level, means there is some injury in the wrist joint, so the answer will be your scaphoid fracture. Okay, the answer will be your scaphoid fracture. So thanks for watching this lecture. We have completed the entire upper limb की theory as well as very easy questions, अच्छे questions and clinical based questions we'll discuss. So I have a marathon question based session जिसमें अपन सिर्फ और सिर्फ 2 से 3 घंटे तक ओनली एमसीक्यू से डिस्कस करेंगे tomorrow at 8 a.m. as special class, so please do attend that special class. Thanks for watching. If you like the video, please like, share and subscribe, and watch my other videos on the YouTube and the special classes. And you can subscribe for any of the subscription plans on the Unacademy and use my code, that is Anshul B10, to get extra 10%.